Hello, we're a group of students from Worcester Polytechnic Institute researching under both Professor Tulu and Dr. Elchmali. We would like to present to you today on our project on developing an application for understanding fatigue in patients with lymphangioliomyomatosis. This project will be in fulfillment of our major qualifying project at WPI. The MQP helps you put theory of what you've learned into practice to tackle real-life scenarios and issues, and it's often sponsored by corporations or other external organizations. First, I'd like to introduce you to our team. So my name is Olivia Gleason.
I'm Evan LeBeau.
I'm Ken Snoddy.
And I'm Alana Zoltan.
Here is the agenda for today's presentation. First, we'll give a brief overview of the project and discuss background information. Then we'll go into our methodology and review the 3 prototypes that we developed. At the end, we'll give you a brief demo of the application and finally discuss our conclusions and recommendations. First, we'd like to introduce our sponsor, Dr. Sukhil Elchmali. Dr. Elchmali is the Clinical Director for the Center for LAM Research and Clinical Care at Brigham and Women's Hospital in Boston, Mass. He specializes in pulmonary and critical care, and his clinical interests include interstitial lung disease, lung transplantation, and LAM, which we'll discuss more now. So, what is LAM? Lymphangioliomyomatosis, or LAM for short, is a rare lung disease affecting women of childbearing age. It's caused by mutations in both the TSC1 and TSC2 genes, similarly to tuberous sclerosis complex, or TSC for short, and can lead to the growth of numerous tumors in organs and tissues. About 1 in 6,000 people have TSC, and only about 30% of those people also have LAM. Shortness of breath is commonly observed with LAM patients. However, as Dr. Henske stated at the LAM conference, fatigue is experienced at the same level as of shortness of breath. Therefore, there's a need to pursue more research in the matter of fatigue in LAM. In general, LAM is poorly understood, although researchers have found that fatigue in LAM is not correlated to lung function. Understanding the cause of fatigue can significantly aid LAM patients, as fatigue can greatly decrease the quality of life for patients to the point where it can interfere with their day-to-day activities. Dr. Elchmali once said, "These patients with LAM experience many different symptoms, but the one they complain to me the most about is fatigue." So the problem of fatigue is the motivation for our MQP project. The goal of our project is to develop a mobile application that gathers contextual factors from its users, who are LAM patients, that can't necessarily be gathered at clinic visits. Clinicians are able to study the factors that come from clinic visits, but we're focused on examining the contextual factors that come from daily activities. This data will be used by clinicians to understand the relationship and any possible correlations between fatigue and daily living factors. But first, the data must be collected, which is where we come in. To collect data about these contextual factors, we will develop a mobile health application, as we believe it will provide an easy way to collect data from patients. Mobile health applications, or mHealth apps, are used to practice medicine and public health for patients and clinicians through mobile apps. This is an extension of telehealth, where the clinician primarily drives the actions. mHealth apps are patient-driven, where the patient generates the data through the use of their apps. The use of mHealth allows the clinicians to collect and compile data on patients and can seamlessly monitor and diagnose patients. In our research, we analyzed 4 mHealth applications with features related to pain and symptom management that had a 4.0 star rating or above on the Apple App Store. Our review focused on reports that showed graphical representations of user data, simple and intuitive interfaces, daily data gathering methods, and had a target audience. This analysis helped the team establish a baseline understanding for how to design and structure the application. Now, Alana will discuss the methods we use to achieve our project goal.
So as Olivia talked about earlier, the goal of our project was to create a mobile health app prototype that would gather contextual data to help researchers understand more information about patients' daily living factors and how those may be contributing to their fatigue. So to do so, we established the following 4 objectives. The first was to review existing mobile health apps to understand how those may guide the development of our application. Following that, we identified system requirements that would aid in the design of our app, which we then tested with target users. We used an iterative development approach throughout our process so that we could continuously improve our application while collaborating with our sponsor and conducting testing. We developed our app in a series of 3 prototypes, which each built upon the previous iteration, and we're going to talk about those now. So first, we completed a brief planning and brainstorming phase where we identified the initial requirements for the application by having conversations with our sponsor and doing additional background research. So through these meetings and research, we identified that the app will have 3 main features, which included tracking fatigue every day, daily check-ins where they would fill out surveys about their day, and progress views where patients could see their data. After identifying this initial set of requirements, we brainstormed ideas for pages in the app and had wireframing sessions where we identified the overall flow and design of our application. In this phase, we also researched existing data scales for the measures we were interested in tracking to see how those existing measures could be applied in the use of our application. And all of this served to guide us in the development of our first prototype. After the initial wireframing session, we developed the first prototype of our app. And the purpose of this iteration was to create a prototype that looked and felt like a real app so that we could conduct usability testing with patients. So we wanted it to have similar functionality and design to what our app would eventually look like. So we created a low fidelity prototype using a web application that enabled us to create a design and some functionality for the morning and evening surveys of the app, as you see on the screen here. We conducted interviews with 11 patients at Brigham and Women's Hospital in Boston and also at a LAM regional education meeting. We met with these patients and showed them, each participant, 2 interface prototypes for each data point that we were interested in recording. And these included different options for each measure. So for example, some of the options had them tapping on a text box versus sliding on a number scale or inputting text manually. Some of the options had icons, others didn't, and we did all of these differences so that we could understand what type of options the patients preferred and what would be easiest for them to use. We asked them to provide feedback and suggestions for our app regarding their needs as LAM patients. And we also gave them the opportunity to test the prototype on a mobile device and asked them to perform a list of tasks to see how they would do using the user interface. So despite our small sample size of 11 patients, we were still able to deduce important findings about the design and functionality that users like. So on this chart, you can see that we were able to identify the option that a majority of patients liked for fatigue, activity, sleep, and the sleep quality screens. And we chose to create a threshold of 7 votes as our cutoff for identifying the desired option because the screens for water, diet, and check-in did not meet that cutoff. We had to conduct further research on those options by, again, looking at our research that we had previously conducted about existing measures, researching other applications, and consulting with our advisor and project sponsor. So for example, in this scenario, the patients overwhelmingly chose option 1 for selecting their sleep quality because it was more intuitive. They thought it was more descriptive. They could select multiple information points regarding their sleep quality, and they liked the design of this option more. So on the other hand, it was difficult for patients to choose between the 2 options here, which is interested in finding their diet information. As we'll discuss later, we wanted to collect an overview about a patient's diet, which meant creating unique ways to collect their data, but also made it difficult to design an option that was very user-friendly for collecting their data about diet. So we also analyzed the data from usability testing to discover common themes among the responses, aside from just what option they liked the most. So in general, patients thought that the application was really intuitive, quick, and they said that it would be manageable to do every day. They preferred to tap icons or words as opposed to sliding on a number scale for most of the options, but they said that they noted that a sliding scale would be more useful for measures like hours of sleep and the amount of water they had that day because it would be more accurate. Patients liked icons included in the design, but they had some suggestions for improving specific ones so that it would more accurately represent how they felt in that moment. And based on our analysis in this stage of the patient preferences for the design and functionality, we are ready to move on to the development of the next prototype.
All right, so moving into prototype 2, we used prototype 1's usability testing results to create the foundations of the application in prototype 2. This consisted of navigation, various user interfaces, user profile registration, and even some data collection features. So we spent a significant amount of time developing the morning, evening, and monthly surveys, as these make up kind of the bulk of the user's interaction within the app. We really wanted to make the app easy to use for the users so that it would be quick and intuitive each day that they used it. The questions in the morning and evening surveys did have some similarities, which allowed us to use some of the same screens for both. However, on the other hand, some questions such as diet, exercise, and even daily water intake forced us to be a little bit more creative and try multiple different approaches. We also made a report fatigue button on the home screen so that users could report fatigue at any moment of the day. After creating this prototype, we conducted usability testing at WPI's Project Symposium, and we also interviewed 3 patients at Brigham and Women's Hospital. At the WPI Symposium, we had multiple people mention that the user profile screen did not have a save button. This sort of confused them because after changing a setting, the user received no visual feedback that it was saved within the app. Others mentioned that the icons we had used for mood looked more like icons than they did for buttons, so they got a little confused and skipped past them without knowing they had to press one for an option. In the patient interviews, the team asked for feedback on 2 mood screens. One of the screens had icons and colors, the other just had text. And what we found was that some patients liked just option 1 and some patients liked option 2. So we decided to combine the 2 screens in the final prototype so that the question had an icon, color, and text. And we also showed graph mockups for the user report screen. And the main feedback was that bar graphs and line graphs were easy to understand for the patients. So moving into prototype 3, this prototype mainly focused on leveraging the previous usability testing results, migrating the application over to an iOS, and creating the user report screen. So the report screen had not been built out before prototype 3 because we wanted to make sure users understood the graphs we were thinking of using, which we had showed them in prototype 2 usability testing. So we had made a report screen with sample data for fatigue and diet, as you can see on the right. And we had also moved the app from a development environment to Apple's Xcode. By moving to Xcode, we were able to successfully compile our app within the iOS environment. And once we had the app on iOS, we created some backend functionality to support the app. Unfortunately, we were unable to perform usability testing on the last prototype because of the project timeframe. So for the backend development, we developed 3 main things. We developed push notifications, a database, and API calls. The push notifications are basically those little alerts on your smartphone for a given app. We thought these would be essential to have in the final app so that we could inform users of when their surveys were available. We also created a database which stores the data collected from the app on a MySQL server. The only data that would be stored here is the data from the surveys, as well as the user profile data seen within the app for a user. And lastly, we created the API, which essentially is just what sends and receives data from the app to the database. So we have several additional recommendations that we believe could improve the app for future use. We suggest adding an initial survey to the application that could allow users to customize their profile setting prior to using the app. Also, the patient should be able to specify if they are currently experiencing a menstrual cycle, because if the user does have a menstrual cycle, a corresponding question should be included within their monthly survey, and if they don't, it wouldn't be included. We also recommend developing an admin portal for researchers to have access to information and dashboards to view and maintain the user data from the surveys. And for the report screen, we suggest adding the option for the user to plot any data measure with fatigue so that they can be viewed side by side. This would be very useful for a patient so that they can see if there's any correlation in their data. We also suggest conducting further research on how to properly plot diet data, which was a particularly difficult process for us. Also, we implemented push notifications, but we think they could be improved to be a little bit more customizable by the user to be sent at times that work best for them and not times that are chosen by the app. We designed the app to work with both iOS and Android. However, we did not get the chance to move the final project to Android Studio to make the app compatible with Android. So we suggest that the Android version is created, which shouldn't be too difficult or have too much overhead, as most of the work was already kind of front loaded. And lastly, Professor Tulu is working on additional research involving creating a wearable patch that essentially measures blood oxygen levels. Integrating this device with the data collected through the application could help clinicians better understand kind of the relationship between fatigue and oxygen levels.
Okay, so I'll be going over the demo of the app. So let me just share my screen. Okay, can everyone see the phone? Okay, so when the user first opens the app, they'll be greeted with the login screen. And so they'll enter their user ID provided by Dr. El-Chamali and their password to log into the app. If they do not have an account, they could configure their account. And this is where an initial survey should be further developed. So currently it asks if the user is on rapamycin, oxygen, or an inhaler. And then it asks them to create a password for the application. And then they could create their account. So this is the main home screen of the app. So just 1 second. The user can, through this, go into their morning check-in, evening check-in, and monthly check-in. And so going into the morning check-in, it first asks you how they're feeling. So they have an option from great down to awful, and they can select next. And they can also select their stress level and pain levels from a scale from 0 to 10. And if they have any other comments, they can put them in the comment box below. Next, it asks you how fatigued the user feels from a scale from not at all down to overwhelmingly. And then the hours of sleep that they had last night from 0 to 12 plus. Lastly, it asks the user about their sleep quality last night. So there's different measures such as difficulty falling asleep within 30 minutes or having nightmares. However, if the user experiences a different type of sleep quality measure that's not listed here, they can also put in their comments down below. And that finishes the morning check-in. Going into the evening check-in, it shares some similarities to the morning check-in with the asking how their day was, and then their stress level and pain levels, and their fatigue level. However, it also asks the user how much water they had that day, and the user can select, click on these question marks above to kind of gain more information if they're confused about the question. And so here it tells you 1 cup equals 8 ounces. Next is the overall activity level from a scale from none down to vigorously active. And the diet page. So the user has sugars, fruits, carbs, proteins, fats, dairy, and vegetables to choose from. And there's also a question mark to gain more knowledge of different types of examples for these food groups. And the user essentially chooses if they had less, average, or more of these different types of food types. And we hope that in the initial survey is implemented so that the admins know what that average is for that specific user. And lastly, we're going into the morning check-in, monthly check-in. So it asks the user to select a date range of their menstrual cycle from the past month. And so the user can select their start date and their end date, and they'll select that range for their menstrual cycle from the past month. Moving on is if the user has been to the emergency room in the past month, please explain what happened. If not, click next. So they can put in any comments that they had. Similarly, if they went to the doctor for any LAM related reasons, they can put in their comments down below. If not, they can click next. And then the following 6 questions are from the SF6D, which is a tool provided by Dr. El-Chamali. And I'll be going through these questions as they are pretty long, but these questions were taken from the SF6D, and they kind of help gauge how the patient was or the user was in the past month to determine their quality of life. So there's social functioning, and this one is about pain. And their mental health, vitality, and that finishes the monthly survey. And so on the home screen also, the user can also report their fatigue. So any fatigue episodes that happen during the day, whenever it is, throughout the day, they can kind of input their fatigue level from a scale from not at all down to overwhelmingly. And they can also put in any comments additionally to that fatigue episode and submit it. Moving on, so for the profile screen, the user can customize their profile by enabling or disabling push notifications. If they're recently on rapamycin, they can also enable this switch or oxygen or an inhaler, and then they can update their profile. And then finally, the report screen. So user can see their data on a weekly, monthly, or yearly basis, as shown here and this is specifically for fatigue. However, a user can also select different types of measures such as stress, mood, pain, and see their data here. And clicking back to home brings them back to the home screen. And so that was a demo of the app, and I'll be going back to the main presentation. Okay, so for the next steps of LAMTrack, we recommend that these 3 key points are implemented in the future phases of the project. So the first one is implementing authentication. So as you saw, the login screen is properly created. However, there's no way to properly check if a user is in the database and then log them in. So therefore, proper authentication methods and security measures need to be implemented so that a user is confirmed to be who they say they are. And this user data should also be encrypted so that the application is secure. Next is finalizing the report screen. So as you saw, the report screen is currently complete for the user interface. However, the values are in the data array are constants to show example graphs. And so these constants need to replace with the values that the user inputted in the database. And so the application will need to communicate with the backend server, allowing for the report screen to be specific to the user's inputted data. And lastly, we recommend that the app is published onto Apple's test flight. So Apple's test flight allows for beta testing by inviting users to test their apps and collect valuable feedback before releasing the application on the App Store. And so we believe that LAMTrack should be published onto test flight to conduct field usability tests to ensure that the application is ready to be pushed onto the App Store. Next, we have some acknowledgements. So we would like to thank Dr. El-Chamali from the Brigham and Women's Hospital for providing us with this interesting project and generously providing his time and resources. Thank you for entrusting us with this project, organizing patient interviews, and providing us with the space to conduct our interviews and present our findings. We would like to also thank the participating LAM patients that so willingly agreed to take their time to help us gather requirements and feedback. From the LAM Foundation, we would like to thank Shefali Bagwe for helping with the coordination of our patient interviews and making us feel comfortable in our hospital visits. From WPI, we'd like to thank our project advisor, Bingsu Tulu, for guiding this project and showing tremendous support throughout its completion. Thank you for continuously challenging us and providing us with a valuable experience and thoughtful advice. Finally, we'd like to thank Theodoros Konstantopoulos for his contribution and expertise in developing the application. Next, Olivia would like to talk a little bit about her work on a project extension opportunity.
Thanks. So before we conclude our presentation, I'd like to introduce an extension to this project. I'm double majoring in data science and therefore am completing an MQP for that degree as well. And for my project, I will be investigating how to visualize patient-generated health data, or PGHD, to create a dashboard to view the data collected from LAM track for clinicians. Since the application is not published, I'll be using sample patient data. I'm also interested in adding demographic data to the dashboard, as clinicians will already have access to this data and it can be used in conjunction with the app collected data to determine any correlations. My project advisors, Professor Tulu and Professor Strong, and I have decided to use Tableau as the visualization software. Following this presentation, I would like to speak with Suhail to gather any feedback on this extension and determine what demographic data should be analyzed.